Hi, my name's Rebecca Shutter and I'm a therapist. I've been working in inpatient and outpatient mental health hospitals and in private practice therapy for almost 10 years now. And I finally let my patients convince me to make a YouTube channel with some videos of different techniques that we use in session. I'm really glad that they finally talked me into this because over the last 10 years, really working with people from all walks of life, at all levels of crises, from very severe acute crises to just some daily maintenance that needs to be done, just wanting to get their lives back on track to wanting to actually live their lives. And the biggest thing that I've gotten of feedback from them is that they feel so great when they're in treatment, when they are in the hospital or in the outpatient program, and when they're seeing their therapist regularly. But they really would like for some more tools to be available to them so that they can work on their own. When someone is in an inpatient hospital, they're trying to get all of that information to soak in, to stick with them, but it can be really hard to remember what you learned and when to apply it and what the phrasing was. So each of these videos will be titled with a different type of technique that we use in my hospital and that I use in private practice. And it really can be used for anybody. Anyone who, whether you're in therapy or not, needs just this reminder of what to do when, or just needs a little pep talk every once in a while. And these videos can also be used by therapists to help integrate some new techniques into your therapy practice. I practice primarily solution-focused therapy, which is becoming more and more well-known. I'm really excited to see more people know about it. But a lot of therapists aren't completely trained in it. And it's just a really great way to get your mind out of the problem and start working on a solution without having to just be completely bogged down by the problem-focused thinking. And that's why I've entitled the YouTube channel Solve Your Own Problems. And I'm not cutting the middleman out here at all. Therapists are very important, treatment is very important, but it's also really important to be able to take some of that control and really implement these things for yourself so that you don't become too reliant on someone else, and you don't feel like you don't have any control over solving your problems. So each of these techniques is loosely based on solution focused. I had the really amazing honor of studying at a school that paid very close attention to solution focused. One of our professors was a very well-known published author of solution focused therapy. And I studied abroad in London at the Solution Focused Brief Institute and learned a lot about it then. It truly has changed the way that I view therapy, the way I do therapy, and the way that I live my life. So you'll see a lot of that in these videos, but I also pull from several other types of therapy approaches. I use a lot of narrative therapy, existential, and then I'm also always going to bring in a lot of the holistic aspect of it, mind, body, soul. Whether you're religious, spiritual, or absolutely not, it doesn't matter. For you to participate in this, all you really need to do is be ready for your body and your mind to align. I also think it's extremely important for us to understand the neuroscience behind what's going on when we're suffering from mental health issues. It's something that's going on in our body and in our brain. It's not just some elusive emotion. So I cover a lot of that as well. Please feel free to subscribe to the channel, send it to friends, send it to family members, and always feel free to make a comment. I take criticism very well, and I'm always looking to better this because it's not for me, it's for you guys. And if you have something you would like to learn about or a video that you would like to see, please feel free to leave a comment and I can make a video for you. Thank you guys so much. I hope you enjoy the channel and I hope you learn to solve your own problems.